Hello, good evening. My name is Dr. Chudi Ufondu, and today it's a great day. Today is the very first day of August 2023, and today we have to talk about one of the most important organs on the body, the kidneys. So, what's the effect of drinking water as you should on the health of your kidneys? Very, very important. If you noticed, there is a very sharp rise in cases of kidney problems, kidney failures, dialysis, kidney transplants. Now, before we even get to that stage of requiring special care of our kidneys, there are things we can do by ourselves regarding what we consume, the fluid we consume. So, thank you so much for coming this evening. I'm going to spend about 15 minutes to provide you background on what you need to know about water, about your kidney health, and the precautionary measures you can take. Very important. So share this particular topic, share this particular video to all your networks because it might be life-saving. Whatever you're going to learn this evening will help you to understand better the need for you to be more careful because there are certain medical problems that once you develop them, it's going to just be management until you go. There is no permanent solution to having kidney problems. So we have to, first of all, prevent having kidney problems. So thank you so much. I can cite COO. COO, thank you so much for joining. I hope August is going to be an amazing month. It's going to be 31 days of amazing. So brace up for so many blessings, so many positive pregnancy tests, so many new babies, so many new jobs, so many promotions. I'm so excited about the possibilities of what we're going to achieve in August. If today is the first day of joining me in YouTube, my YouTube clinics normally comes up by this time on Tuesdays, then Saturdays, 3:30 p.m. So if today is the first day of joining me in YouTube, please make sure you subscribe. Subscription is very simple. Click on that notification button, click on subscription, like the video, share the video, tell people about this channel. There are so many important, healthy videos out there that will help you a lot. So make out time and go and watch them. So let's talk and see what we have today. So generally, the topic is drinking water, kidney health, and your overall health. Now, we have to definitely understand the major role of the kidneys. Our kidneys are very important in keeping us alive. If your kidneys are not working properly, you have a problem. Thankfully, God gave us two kidneys. Our kidneys will help us to eliminate toxins and harmful substances from our body. So every day there are so many things that enter your body through your mouth, through your nostrils, and through what you eat. It's the function of the kidneys to remove those toxins from our body. Now, we have to look at our kidney from a place of being water-wise. So the mantra for this particular broadcast is, are you water-wise? So when I say water-wise, what does water-wise mean? This simply means drinking the right amount of water for you. Now, I'm sure you've heard so many, theories, so many myths about drinking 8 glasses of water every day for everybody. That's not true. Please, we need to correct that misconception. It's not everyone that will have a specific need for a particular amount of water. What you need will vary from person to person. So factually, the water you need, which will help your kidneys, it's based on a couple of factors. Number one, your age. Very important. So it's not the amount of water that a 65-year-old woman will need, that a 65-year-old man will need. So women and men need water differently based on age. A kid of 10 will need water based on some parameters for a kid of 10. A lady at 20 would need water based on what she needs at 20. A lady at 30 is something. So your age will determine the quantity of water you need on a daily basis. Your climate, for example, Kenneth is in in New York. I'm in Florida. Florida is very, very hot. Now, by default, I will need more water compared to Kenya, especially during summer. It's very, very hot. The temperatures are crazy. Kenya is in a colder region of America. I'm in a hotter region of America. So between the both of us, I will need more water compared to Kenya. So your climate determines if you need more water or if you need less water. Now, your exercise intensity, your activity intensity, the more you exercise, the more you stay active, the more you're sweating, the more you need water. Because when you're losing fluid from your sweat, it's insensible loss. We need to replace that fluid. So your intensity of physical activity will determine if you will need more. So if you're someone that sweat a lot, by default, you need to replace that fluid you're losing also in sequence. Pregnancy. Pregnancy is a state that by itself might lead you to dehydration. If there is anything to avoid in pregnancy, is dehydration. So you need to stay well hydrated in pregnancy. Breastfeeding. Breastfeeding will also predispose you to having dehydration. So the factors I'm mentioning are things that will warrant you to drink water more. State of illness. So there are a couple of illnesses you will have will restrict you from drinking water, and there are a couple of illnesses you will have will want you to drink more water. Generally, 60 to 70% of our body weight is made up of water. So think about that. So we are practically water moving around. 60 to 70%. Every part of your body needs water to function properly. So like I said, water will help your kidneys to remove the waste product from your body through urine. Liver would also perform a couple of roles when it comes to making sure they remove the impurities in our body. But the kidney is really, really huge when it comes to keeping you alive. So water will also help your blood vessels to open so that blood can travel freely from the kidneys to deliver essential nutrients to the body. The kidneys are also the place that red blood cells are made through the erythropoietin, which I'm not going to bother you into the academics. So by and by, if you do not get enough water, you will become dehydrated. And when you become dehydrated, it will be difficult for your body to perform optimally. So dehydration will not help your body to perform optimally. So at any point in time, you need to make sure your body is getting enough water that will allow your body to perform optimally. Mild dehydration can make you to be very tired. It can impair your function. You can have confusion. You can have foggy feeling. You can even faint. Just mild dehydration. So imagine what severe dehydration will do. Severe dehydration will damage your kidney. So it's important to drink a lot of water. If you're currently not drinking a lot of water, you're not helping your kidneys. So by default, if there is any other habit to form, starting from today, drink water. Anytime you're drinking water enough, you're helping your kidneys. You're helping your kidneys to make sure your kidneys is optimal in the daily role your kidney is supposed to perform. So I'm going to give you a couple of tips that will help you to make sure you're drinking a lot of water, enough water to make sure your kidneys are healthy. Now, I've already debunked the concept of 8 glasses of water. It's not everybody that will need 8 glasses of water. It's not set in stone. So 8 glasses of water is not universally recommended. Now, 8 is okay if you can. There is no hard and fast rule in the far, you must drink 8 glasses of water every day. It's not true. Now, the water requirement for men would differ from the water requirement for women and based on the states I've mentioned. So the general recommendation is based on the fact that if you continuously lose fluid from your body, then you need to drink adequate water to replace it. So for example, if you wake up in the morning and you've been indoors, you haven't gone out, you're not exercising, you're not in the sun, you don't necessarily need all those water compared to someone that is in the sun, someone that has been sweating. Someone that has been sweating will need a lot of water better than you. Now, the Institute of Medicine actually estimated that men will need more water than women. So daily, men will need about 13 cups, about 3 liters of fluid daily, depending on your own unique setup, compared to 9 cups, 2.2 liters for women. So by default, men will need more water than women. Now, there are some women that might need more water than men. Like if you're into sports, definitely you might need more. Now, less is more when it comes to your kidney functions. There are some situations you will have and will restrict water intake. If you have any kidney problem, if your kidney is beginning to fail, You will no longer be removing water from your body. You will be retaining water. In that situation, we'll restrict the water and salt intake. So for those who are on dialysis or any form of treatment for their kidneys, we have to monitor the quantity of water you're using. So you will not be in the category of people that should go and be gulping water anyhow. It's possible to also drink too much water. So too much of everything can be bad. So we have what we call water intoxication. Now, it might not be commoner for a general person, but if you're into sports and you drink excessive water, those water can dilute your electrolytes and lead to a condition we call hyponatremia. I'm not going to bother you on that, but just know that you can exceed the amount of water you're supposed to drink every day and you can have medical problems. Now, your urine would say a lot about the state of your kidneys. If your urine is smelly, averagely, if you're water-wise, if you're drinking a lot of water or other healthy fluids, your urine is supposed to be just a little bit yellowish, just slight yellow or even colorless. It's okay. But when you haven't drank water or you're dehydrated, you will notice that your urine will be deep yellow and smelly and frothy. That's a sign of dehydration. If you notice, if you have not drank water for a long time and you go to urinate, you will notice a stench from your urine. You will notice it's concentrated. It's a sign. So your urine can tell us a lot of things. There are some people that will have what we call microhematuria. It means you have presence of blood in your urine or presence of protein in your urine. So your urine can tell us a lot of things. That's why we'll require you to give your urine sample if you have a medical problem. Now, water will also help to prevent your kidneys from developing stones. Kidney stones are very, very painful. The commonest kidney problems we have out there is kidney stones and UTI. UTI stands for urinary tract infections. So very important to understand this. Your kidney stones and your UTI are very common medical conditions that can hurt your kidneys over time. So the kidney stone will develop lesser if you drink a lot of water. Because the reason why you might have kidney stone is because you're dehydrated or a couple of things that lead to formation of those stones in your body. So when you maintain healthy water intake, not exceeding the level you should go for, possibility you will develop kidney stone will be limited. The same thing is applicable to UTI. Urinary tract infections, you can pick it up from so many things depending on your personal hygiene. So water will help to dissolve the antibiotics, which we'll normally use in treating urinary tract infections. So it can be systemic. Anytime anything is systemic, it can reach all parts of the body through the blood or through the lymphatics. So drinking water will help to produce more urine. Producing more urine will help to flush out so many infections, so many bacterial, viral, or fungal infections from your body. Now, there are some restrictions. There are some people that will need to be on water restrictions. There are some procedures that if you're going for in the hospital, there are certain things you need to drink. If you notice, there are certain ultrasounds you will tell you to go for, will tell you to drink a lot of water. That's because we want to make sure that that particular part of the body is well highlighted. But drinking extra water with certain medications before or after procedure, especially if you're using contrast dye for a couple of investigations, is very important. So before you go for any particular investigation or procedure, read the medication label, ask questions, make sure you're getting enough or your provider is telling you exactly what you need. Overall, if we all play our role better, if we all drink adequate quantity of water based on the criteria I've mentioned, we will be helping our kidney to perform optimally. Thankfully, we have two kidneys. So if for any reason one of the kidneys fails and the other one is healthy, you can still perform better with one kidney. That's why people can actually give kidney donation. You can donate your kidney. If the other one is good, you can live with one kidney. So anytime you have two structures in the body, you can actually live with one. So there are some people that are so generous and maybe just for the way God made them, they can donate any part of their organ and they can use the other one to survive. So the watchword is drink the amount of water your body requires based on your age, based on your climate, based on your medical problems, based on your state like pregnancy, like dehydration or breastfeeding. Just know that there are some conditions that will require you to drink more water. Now, even in regards to fertility, when you drink a lot of water, your fertility will improve, because when you drink a lot of water, it will help to flush out a couple of impurities in your body, improving your fertility. So drinking water will by default improve your fertility. So water is such a good friend to so many things that happen in our body. Okay, so that's my presentation. Now I'm going to give us an opportunity to start asking our questions. I can see EIV or SARS is in the clinic, and I can also see COO. So if you have any questions, feel free and ask your questions. The clinic is open now for questions. Immediately after this clinic, I'm going to run another clinic on Facebook. So join us on Facebook immediately. We are currently looking for a very cool topic for August. So the last Sunday of August will be our masterclass. Our July masterclass was amazing with Professor Sama. Don't miss August for anything. So please, the clinic is open now for your questions. Start asking your questions. And if you need help, I can help you. I can help you to become pregnant, but I can't help you if you don't indicate you need help. So if you need to expedite on your ability to become pregnant and you're resident in Nigeria, consider getting a package. When you get a package, we're going to process you. Once you're done going through your processing, you will start your consultation. It's my firm belief that by the special grace of God, I will help at least 1,000 women to become pregnant in this month of August, by the special grace of God. That's my goal. That's my dream. That's my objective. That's my motivation. So you might be among the 1,000 women that will become pregnant in our community. Okay? It can be difficult to develop a habit of drinking water. Any tips? Correct. Even me, I struggle with water. But this is the best tip I will give you, Kenneth. You see, most people are in love with their taste buds. The reason why we are not drinking water is because we cannot drink water. We are not drinking water because we see water as bland. We can drink any sweet things, anything that we feel, will give us that high, that kick. So that's why people are addicted to soda, to malt, to juice, and even alcohol. But guess what? We only have one hunger center in the body. Whatever you put in your hunger center and you convince your hunger center, you will feel satisfied. Now, how I thrive regarding water is to use flavor. So there are some 0-calorie flavor you can put in your water, throw in your eyes. When you're drinking it, you will feel like you're drinking the best juice out there. So if you go to any of your outlets, you can just buy a couple of them, just sprinkle it into your water bottle, put your eyes, and you're good. It's amazing. It will blow your mind away. 0-calorie. You're drinking it, you're feeling like you're drinking juice. When you do that, you're going to confuse your hunger centers. Now, remember, when you're eating your fruits, you're drinking water because fruits contain a lot of water. So just make it a point of habit to, keep your water bottle just within the periphery, home, walk, that way it will always remind you to drink water. So that's my own go-to. That's my own best tip on making sure you drink a lot of water every day. And it works. Is there any relationship between drinking water and fertility? Awesome relationship. Let me give you one example. So many women complain of being dry, like experiencing vaginal dryness. When you drink a lot of water, when you exercise, when you're not dehydrated, the possibility your cervical mucus will increase is very high. The possibility you will not experience dry vagina is very high. So women that drink a lot of water, women that practice their Kegel exercise, women that stay active, women that take a lot of fruits and vegetables, they tend to have moisture in their body. They tend to stay moist. They tend to stay, hydrated compared to women that are not hydrated. So yes, water improves your fertility in so many ways. Remember, we are 60 to 70% of water, our body. Guess what? Our hormones and all those stuff that will make us to be effective in our reproductive health, they all walk through water. So without water, your hormones are not going to be functional. And if your hormones are not going to be functional, you're not going to be able to perform your role. And everything in the body depends on water. Movement of eggs, movement of sperm, movement of blood, everything in the body requires water. So when we talk about the reproductive aspect of health, when you are in a good place regarding the quantity of water you drink, definitely you're going to improve your fertility both directly and indirectly. So the answer is yes. Now remember, when you drink a lot of water, like I mentioned, in your excretion of, waste products and infections and all that, you can flush out a lot of bacteria, you can flush out a lot of virus, you can flush out a lot of fungal stuff that might affect your fertility in a way. So water, it's very good for anyone, especially if you're believing God to have a baby. All right. How can we ensure that our water is clean and safe? This is very important. There are so many waterborne diseases out there, communicable. So it's important that your water is safe. Unfortunately, in developing countries, their waters are not safe. So what can you do by yourself? Avoid just buying any water anyhow, like sachet water and all that, because you don't know how they prepared it. Personally, treat your water. And the best way you can treat your water, the ones you will drink, is to boil your water. When you boil your water to boiling point, you've actually helped to, damage a lot of nyama and a lot of bacteria and virus that might be in that water. So simple boiling your water, being sure of the source of water you're using, especially if you don't live in developed countries. Over here in America, Kenneth will bear me witness, even the water that runs from your sink, you can drink it and you're good. But even at that, we are careful with the water we drink. So make sure your water is properly treated. And the best way you can just improvise regarding water treatment is to boil your water. You can boil it overnight, you can pour it in your container, then in the morning you make sure it's cool, then you can drink it. But don't just drink water anyhow from any source, from any sachet water. Majority of all those sachet water, even the container of the stuff they use in drinking it, can be carcinogenic. There are so many chemicals that can harm your body out there they are using to, prepare all those stuff they sell. So be careful. There are some bottled water. You should also be careful. It's not every Tom, Dick, and Harry that comes with label that you start drinking their water. Drink water from established products like Nestle and Eva and Coca-Cola and all that, if you can. If you cannot, when you get your water from any source, you boil your water before using it. I love those questions. Can one drink water as a way to reduce their food portion during meal? 100%. That's why I talked about the hunger centers. Water is very, very good in weight loss. Trust me. When you are disciplined, if you used to eat this quantity of food, but suddenly you are woke and you want to be healthy, you can divide this quantity of food into 4, and one portion will be your real meal, the other portion will be fruits, the other portion will be vegetables, and the other portion will be water. So you can actually drink water, and water can mimic the food you are putting in your hunger centers, and you will be okay. Especially if you flavor your water. If water is not your friend, if you're drinking it, it will look like you're drinking bitter leaf. Flavor your water, eat a little food, drink a lot of water, eat a little food, drink a lot of water. Before you know, you will be full. The problem is we are not disciplined. So yes, water is very important in controlling your portion size. Very, very important. And for you to control your portion size, you have to be disciplined. Beautiful questions from CO. Please keep asking more questions. Keep asking more questions. We still have a few minutes. Remember to join me in Facebook immediately after this clinic, and we continue the conversation. Ivy or SARS, do you have any questions? Mara Kafu, do you have any questions? This is a very important topic. I know so many people will not take it serious, but we've had so many cases of kidney problems, so many cases of kidney failures, so many people dying from kidney problems because by the time it's diagnosed, it's already late, and it can affect any part of your body. So this is very important too. It's not all the time we talk about fertility. Even this water condition can also improve your fertility, like I told Kenneth. So take this very serious, okay? All right. Do we have any other questions? COO has pretty much asked very key, important questions. So if you still have, please feel free. If not, we're going to round up around 25 minutes and we go to Facebook. Are we good? Make sure you share this video. If you're not watching this video live, anytime you have opportunity to watch this video, please help me circulate this video. This video might be a saving grace to so many families. So share this video in your timeline, share it in your network. Make sure this video goes viral because it's a very helpful video that can save you a lot of heartache in the future. All right? COO, if you give me a signal, if we no longer have questions, let's round up around the 25th minute mark so we can hop into Facebook and we call it a day. I wish you guys all the best in the month of August. August is going to be amazing. I'm already feeling the beauty of God. Any tips on using water drinking to prevent kidney disease? The same thing, just stay on water, but don't overindulge in water. Remember, you can have water intoxication. So the same tip applicable to what I've already shared before is what you should do. Depending on your climate, depending on your state, like if you're pregnant, you consume more water. If you're breastfeeding, you consume more water. Like if you're breastfeeding, water will even help your breast milk to be flowing better for your baby. Breastfeeding, the same thing. Pregnancy, the same thing. So make it a point of duty to have water around you 24 hours. At work, at home, in the gym, going for a walk, just have water around you. In America, we have so many water stations around because people can go into extreme dehydration and they can have medical problems. So pretty much straightforward, just make sure you're not overindulging, and there is no one size fits all regarding water. What Okeke might contain, Okafor might not contain. So there is nothing like, oh, you must drink 8 liters of water. It's not true. You drink water based on your need. Okay? All right. CEO, thank you so much. Thank you, Mara. Thank you, Ivy. I'm going to transition to Facebook now. So please quickly join me in Facebook and we round up for today. Thank you so much. And I'll see you guys again on Saturday. Until I see you, God bless you and bye-bye.